so welcome to this webinar. Nice to see familiar names as well and familiar faces. So good of you to come. I'm really happy to be talking about this topic today, which is non-dissemination and dissemination bias in qualitative research. Claire already introduced me. I think with that, that's enough about me. What I want to say about the research, though, that is behind the topic is that all of what I will be presenting took place in the context of international work in connection with the GRADE-CERQual group and cooperating partners from the University of Sheffield and University of Bangor and the Norwegian Institute for Public Health, the Norwegian University of Science and Technology, and the University of Bergen. So yeah, with regard to my conflicts of interest, I am a member of Cochrane, I'm a member of the GRADE working group, and parts of the research were funded by the Research Commission of Freiburg University. But other than that, with that is no conflict of interest, and I do not have any financial conflicts of interest in connection to this topic. What I want to go through today, or what the structure of this webinar is first of all, I want to give you some background knowledge about dissemination bias. Then I will present the empirical evidence around the topic, present you an example, and then go for the questions and answers together with you. What I would like to raise up front is that I want you to be aware that we have not developed final guidance for detecting or assessing dissemination bias in qualitative research. This is still ongoing, so unlike perhaps other Spotlight on Methods webinars, this is still a moving target, and nonetheless, I think this will be useful and raise enough awareness for this topic for you to be helpful. All right, with regard to the background to my topic, this workshop falls into the wider scope of evidence-based healthcare, namely research about methods of evidence synthesis. Evidence synthesis are an essential tool for healthcare decision-making, and their findings are frequently used in guidelines, health technology assessment, or patient information. And many syntheses that I conducted and that we see assess quantitative evidence and express their results numerically. But there are also evidence synthesis of qualitative evidence, so-called qualitative evidence synthesis. Those answer questions that cannot be addressed by quantitative methods, and both quantitative and qualitative synthesis are used in healthcare decision-making and needed there. However, despite rigorous methodological standards being in place for any type of evidence synthesis, there can be issues that reduce our confidence that we can have in the findings and make the interpretation of findings and the application of the results difficult. So now, shortly to you, if I may ask for a brief reaction or a thumbs up or just a Zoom reaction, so to say, how many of you have conducted an evidence synthesis yet? Yeah, a few people, great. And how many of the participants have conducted a qualitative evidence synthesis or are planning to do so or doing so? You can just send us thumbs up or heart, whatever you like. Those are you, but I'm really glad to have you on the call because you'll be my backup on any qualitative questions that are coming up. So great. This gives me a bit of an overview of the audience as well. Good. So evidence synthesis, we need them, and still there are issues. There might be issues in evidence synthesis that decrease their trustworthiness. In order to know how much we can trust the findings from evidence synthesis, there are approaches to systematically assess the certainty of the evidence. And one approach that is very widely used and adopted for quantitative evidence is the GRADE approach. It addresses various aspects within and across the body of evidence that can reduce the certainty of the evidence. And one of those domains is publication bias, or also referred to as dissemination bias. Dissemination bias is a systematic error on synthesis level due to the selective dissemination of studies and individual findings based on the direction and magnitude of their effect. This issue is very well researched in quantitative research, with around 50% of research remaining unpublished. Factors that make a publication more likely and lead to faster publication are positive results, a large sample size, and being funded by non-industry sources. Conversely, negative results are published less likely or later in time. This was found to lead to research waste, a poor allocation of resources in healthcare and health research, and it was shown to lead to the uptake of ineffective or harmful health interventions. What is said here on the slide holds very true for quantitative research with plenty of evidence available, but the picture looks very different in qualitative research. In qualitative research, there was only one study about non-dissemination in qualitative research until 2015. And we have no evidence for dissemination bias in qualitative research. Still, the plausible relevance of dissemination bias is accounted for in the GRADE-CERQual approach, which is an analogy to the GRADE approach only for qualitative evidence. But since so little is known about it, dissemination bias is only a candidate domain in this approach. So we found that the very harmful, evidently present impact of dissemination bias in quantitative research and the clearly existing knowledge gap about non-dissemination and dissemination bias in qualitative research are perfect reasons to pay more attention to this issue and to conduct more research. This was it for my background. Any questions so far?
I can't see any comments in the chat, Ingrid.
All right, great. Then I'll go to the aims for this webinar. I would really like for you to become familiar with the relevant published empirical evidence about non-dissemination in qualitative research. I want to raise awareness of the plausibility of dissemination bias in qualitative research, and I would like to encourage you to consider dissemination bias in qualitative evidence synthesis. First of all, let me present the empirical evidence. The empirical evidence mainly consists of 2 surveys that we have conducted and 2 cohort studies of conference abstracts following conference abstract from presentation at the conference to full publication. In the first survey, we wanted to gather information about proportions of non-dissemination and attitudes towards dissemination bias in the research community. More than 1,000 people initiated the survey and participated, and we had a very good representation of researchers, peer reviewers, and editors. Most of the participants were female, and the participants' main regions of work were Europe and North America, a picture that is very consistent across our research. The median age of the participants was around 50 years, and almost all of them communicated their findings primarily in English language. The most striking finding of our survey is that around 70% of the participants said to have at least one qualitative study that was not published at all. Around half of the participants said that they had at least one qualitative study that was not published in a scientific journal. When we asked them about the reasons for non-dissemination, they said that the publication is still planned, that they had resource constraints, or that the paper was rejected by 1 or more journals. We also asked them about reasons that hinted at a systematic non-dissemination due to the content or message of the findings, but Findings that did not confirm the author's assumptions or findings that were controversial were rarely selected by the participants as reasons for non-dissemination. In their free text responses, the participants said that the publication process of journals hindered the publication of qualitative studies in a range of ways. For example, through imposing word limits for manuscripts or editors' and peer reviewers' ways of assessing qualitative research. Then in the survey, we also inquired about the non-dissemination of individual findings, because this seems problematic in that entire issue as well. And around 1/3 said that they had at least one qualitative study where important findings were missing. Reasons for the non-publication of findings were said to be comments from a peer reviewer or editor, not enough resources to write up the findings, or data quality of the findings was seen to be insufficient. As said initially, we also asked editors and peer reviewers about the reasons for non-disseminating qualitative research. And they responded or agreed that there were mostly reasons related to the quality of the study and the study reporting that were relevant for the decision to not disseminate a study, or a mismatch between the journal scope and the study topic. With regard to the attitudes of the participants towards dissemination bias, 40% of the participants agreed, for example, that a registration of qualitative studies and publication of findings in a study registry might decrease dissemination bias. One participant said, if we could refer to the published methods in the registry, we would save enough space to publish more findings within the journal length requirements. But another researcher said, it is time that's the major factor in writing up study findings, and a register would not address this. Perhaps a question to the qualitative crowd, or rather the qualitative researchers in the crowd. What is more critical for you in reporting qualitative studies? Is it time or space in the journal requirements? Perhaps you can just post time or space in the chat to respond. But they're quite balanced. Yeah, great. Thanks for your responses. Please keep responding if you like. I'll go to survey 2 that we conducted. In the second survey, we wanted to examine reasons for the non-dissemination of qualitative studies that are particularly connected to the message and findings of the studies more closely. So in the first survey, we retrieved a lot of answers that hinted at generic issues in research publishing, and now we wanted to see whether anything that hints at dissemination bias is relevant for the research community. This survey was nested in a cohort study that followed up the full publication of qualitative studies that initially had been presented at health conferences. So one purpose of the survey was to inquire about the full publication, and then we added questions on top about why they hadn't published their findings. And I'll present the cohort study findings in just a bit. The participants, we surveyed 130 researchers, most of which reported to be established researchers, females, and from Europe or North America. Of these participants, 30%, around 30% reported that their study had remained unpublished. That was a particular study that we asked them about, and they said 30% had not published that particular study. We also asked them about the reasons for non-publication, and most of the participants disagreed that the content or message were factors that influenced the dissemination decision. Only few agreed that when the findings were controversial, not interesting, novel, or important enough, this influenced their decision of whether to publish or not. There's a similar picture when we asked them about the reasons for non-dissemination of any of their qualitative studies, and most disagreed that the findings were involved in the decision-making about the dissemination of the study, and only very few, we retrieved only very few agreements that either the findings that were not what the authors had expected, or the findings that were deemed not relevant enough were factors in the dissemination decision. One researcher said, another publication was written in English, including all the results. However, the pandemic hit and the publication was deemed not enough relevance to the pandemic context. This summarizes some of the research study fates quite well, I think. With this, I will go to presenting the results of the cohort studies that we conducted. We conducted one smaller cohort study that followed conference abstracts to full publication, that after a nursing conference in the UK, we wanted to generate initial empirical evidence on the proportions of non-dissemination. And in the study, we sampled 270 studies out of more than 400 conference abstracts from the conference books. Most of the studies that we looked at were presented as oral presentations. Most of them had female first authors and first authors from the UK. That is not surprising because it was a UK conference. And the clear majority had first authors with a university affiliation. Most of the studies used one method for data retrieval, had one population group in focus, and almost none of them reported information on funding. A very central finding of that study was that for around 33% of the abstracts, a full publication could not be retrieved around 5 years after the presentation at the conference. And the median time to publication was found to be 16 months. Then we also conducted a second cohort study. We thought this was very necessary to have a more general sample, a more representative sample, to quantify the extent of non-dissemination in qualitative health research in general. And this time, instead of sampling from an individual conference book, we searched the database Web of Science conference proceedings to retrieve our sample. Initially, we screened more than 7,000 conference abstracts and in the end identified a little more than 1,000 health-related qualitative studies that we then followed up. The findings revealed, firstly, the main characteristics of the sample. As you see, we encountered some missing information, for example, about the presentation format, with most of the abstracts having no information about the presentation format. And with regard to the conference location and author characteristics, again, North America and Europe were quite dominant geographically, and females were as well. In this cohort study, we found that around 20% of the studies we couldn't retrieve a full publication for around 20% of the conference abstracts that we looked at 6 to 8 years after the presentation. Of those studies where we found a full publication, most were indeed published as a scientific publication in a scientific journal, and less than 20% were published in other publication formats, which are reports or websites or so. Less than 5% were published in a book or book chapter or in grade literature. All right, and in this sample, we found that the median time to publication was 11 months. So overall, from the empirical evidence, we conclude that the non-dissemination of qualitative research studies is substantial, which gives us good reason to keep investigating this issue and keep looking into this. Besides the surveys and the cohort studies, we also conducted group discussions and expert consultations. We wanted to explore the relevance of dissemination bias and its detection, assessment, and impact, and we wanted to conceptualize dissemination bias in qualitative research and advance related concepts. Yeah, I was just wondering whether I should share some details about the group discussions, who attended. I'll do so before explaining why not doing so. The group discussions were attended by 10 to 30 participants respectively. They were then in the group discussions split in small groups of 4 to 12 participants. We had international healthcare research participating as well as medical professionals, and most of them had experience with qualitative research. The group discussions were held at Cochrane colloquia or a Global Evidence Summit. And the expert consultations were attended by healthcare researchers with expertise in dissemination bias and or qualitative research. We were up to 9 researchers from the UK, Norway, and Germany, and we met online or in face-to-face meetings. One of the most important elements that resulted from the group discussions and expert consultations is the definition of dissemination bias. It reads, dissemination bias is a systematic distortion of the phenomenon of interest due to the selective dissemination of studies or findings of studies. We selected the term dissemination bias instead of publication bias due to the larger scope of dissemination bias. Publication bias is more narrow. We also wanted to emphasize that the error that results from that is systematic and not random. Then there's the term phenomenon of interest covered in this. The phenomenon of interest is an analogy to what the outcome is in quantitative research. And lastly, we also wanted to cover the elements studies or findings of studies. So because the issue is the issue of dissemination bias can arise from both the selective study publication or selective publication of findings. I would like to add a word of caution here to clarify what dissemination bias is not. So dissemination bias is not merely the non-dissemination of qualitative research. It is also not the unwillingness of journals or editors or peer reviewers to publish qualitative research. And it also does not address the difference in proportions of qualitative research published compared to those published of quantitative research. We also found different underlying mechanisms to be relevant for dissemination bias in qualitative research. These are time lag bias. And this describes that studies with less striking findings or less newsworthy findings are published later than studies with remarkable findings. We found truncation bias that describes that researchers often choose to employ books and reports as a medium for communication, as these are less constraining than journal articles. And still, often literature searches are confined to journal articles and therefore produce truncation bias because they cannot retrieve the full account of the studies published. Then we found that language bias might be at play as well. This bias describes that striking study findings in a study might be more likely to be published in English language and in an international journal, which in turn increases the retrievability and accessibility of that study. And still, expressing small nuances of speech and language that might add to the correct understanding of the phenomenon of interest might be more challenging for researchers who are not writing in their first language. So, less striking findings are probably more likely to be published in national, non-English journals where the readership is limited and the reports are more difficult to access, for example, through literature searches. Then lastly, as a related bias, we have gray literature bias, and we found, or we suspect that there's increased publication of less noteworthy study findings in outlets other than peer-reviewed journals. We think that limitations on article length can be overly restrictive for the full reporting of qualitative research, and many researchers therefore publish their findings in reports, on websites, and social media, and other websites and newsletters. And an issue with that is that gray literature is often not peer-reviewed and indexed in major scientific databases and therefore harder to retrieve for evidence synthesis. All right, this brings me to more of a stimulating slide, I hope, for you, or thought-provoking slide. This slide presents the findings of the group discussions that we had, and they are presented as a network that builds on the coding trees of the analysis. And for this workshop, I would like to limit the slide on the topic of detection because it seems most important. And for the detection, we found that there's a number of ways to look at detection, to prevent it, and as well to detect. So in that context, it is important for all of us to publish accessibly. So it facilitates the detection of studies and prevents dissemination bias. What we should also pay attention to is to ensure congruence between abstracts and full text. The study selection and qualitative evidence synthesis are often based on the titles and abstracts, even the searches. And if the abstracts and the full text are not congruent, this might lead to the false exclusion of studies or the false inclusion. The people we discussed with also said or expressed that they think that the detection of dissemination bias might depend on the competence of qualitative evidence synthesis authors. So they think that depending on their methodological expertise or the content knowledge, they might be more or less likely to detect dissemination bias or gain an understanding of whether it might be at play. What we could do in order to detect it is to contact primary study authors about the qualitative evidence synthesis findings and confirm with them whether in the synthesis we arrived at the right conclusions or summarized correctly. And we should be transparent about the publication of details about the aims of the study, the methods, and the results. Then, sorry, what was very dominant in the group discussions is that we found that triangulation of data from multiple sources might be relevant to detect dissemination bias. So we thought it might be interesting to conduct expert consultations beside conducting a qualitative evidence synthesis to understand whether the results really match between those two sources of evidence. We could also ask information from health service users about whether they are coherent with what we find or whether something is missing systematically. Then it was suggested that we could also look at research theory or logic models as background information. And if we find that there are elements or aspects in theory and models that are not covered in our qualitative evidence synthesis and the underlying evidence, this might be a hint at dissemination bias. In a few instances, qualitative studies might be registered and have information about the study aim and methods we could look at in order to understand whether there's any difference between the information in the registry and the published study. The same goes for study protocols. Some might be published and therefore serve as good background information. We could also conduct a primary qualitative study alongside a qualitative evidence synthesis to understand if what we find in the qualitative evidence synthesis really aligns with what we find out in an original study. And what we should test for, if available, is discrepancies between grey literature and scientific publications of qualitative studies. I'm aware that the above was quite theoretical now, and the practical sides fall somewhat short in terms of sharing experiences. Therefore, we recently started collecting case examples that should help to illustrate how, when, and why dissemination bias might come about. This is an ongoing research effort, so if you are of the impression that you encountered a situation where you did not disseminate study findings because of their content or message, we would really love to hear from you, either personally or through the survey that we are currently conducting. And perhaps the following example will stimulate your memory and thinking of it. What we collected as an example in terms of dissemination bias is the following. A researcher reported that in many countries, particularly in low resource settings, frontline workers often go to extraordinary lengths to keep services running. They may spend their own money on supplies, use their own transport for patients, and contribute other personal resources to support service users. And in one project, a research team interviewed policymakers about their views and experiences of this practice. Some of the responses were striking. Policymakers expressed satisfaction that frontline workers were taking these steps, treating it as almost as an acceptable way of supporting the health system. One senior policy leader even described these workers as donors to the healthcare system and said she was pleased with this arrangement. For the research team that was investigating this issue, these findings raised a difficult dilemma. They were concerned that including such quotes might reflect poorly on the policymakers and, by extension, on the government. And this also carried practical risks for the wider project, since the team depended on the continued access to these officials, both for the implementation of the project and for disseminating the findings. In the end, the research team decided that several quotes should be removed from the analysis. The team acknowledged, however, that this came at a cost. It became harder to convey the central point that responsibilities were being informally shifted onto frontline workers. So if that's an example, so if you have something similar, here's a survey link that we'll also share or happy to share after this webinar. And this brings me to the summary of my content, basically. What we found is that the proportions of non-dissemination in qualitative research range between 20 and 70%. Self-reported reasons for non-dissemination rarely relate to message and findings of the study. We now, dissemination bias in qualitative research is perceived to be a relevant issue. We now have an accepted definition of dissemination bias in qualitative research, and we have indications for approaches for identifying dissemination bias in qualitative research. All these findings are written up in these scientific publications, and I would really like to acknowledge the local team that I'm working with, that is Jörg Merpol, John Miranda, who helped me conduct the studies, Julia Stadelmeier, Marvin Weber, Max Toews, Waldemar Siemens and the rest of the EFAM team. And then, of course, my international colleagues. First of all, Claire Glenton, thanks for being the host of this webinar and a very supportive colleague on this topic. Simon Lewin, Rigmor Berg, and Heather Montecos, as well as Andrew Booth, who's also on the call, and Jane Noyes. And last but really not least, Katharina, thank you for organizing this webinar, and Damaris for organizing it so well.